Dry-off is a time that can present unique challenges and opportunities for managing doe health. Discontinuing milking can be uncomfortable, but is essential for allowing the udder tissue time to rest and prepare for the subsequent lactation. Dry-off is also an opportunity for bacteria to take root in the udder tissue as they are no longer being flushed from the udder regularly at milking. Dry treatment is one tool that producers can utilize to mitigate these risks and set does up for a healthy, productive lactation. Dry treatment refers to the use of intramammary products such as antibiotics or teat sealants, which can help protect the udder during the dry period. Internal teat sealants are not commonly used in dairy goats, but are common in bovine dry therapy. Many dairy goat producers will utilize antibiotic products at dry-off to support udder health during the dry period. Dry-off antibiotics should always be intramammary formulations, and the label should indicate that it is a dry cow product. There are no intramammary antibiotics labeled for goats in the United States, so your veterinarian will need to provide you with appropriate meat and milk withhold times when they write the prescription for your dry tubes. In herds that practice tapered dry-off, treatment should be administered at the final milking at the end of the tapering period. A full tube of antibiotics should be used in each half of the udder, and splitting tubes between both halves is not recommended. As I mentioned previously, dry-off presents distinctive challenges and opportunities. Because animals are no longer being milked, any bacteria that are present in the udder can settle in and wreak havoc on the mammary tissue. This predisposes animals to developing clinical mastitis during the new lactation and can also create permanent damage to the udder, resulting in decreased production. Long-acting antibiotics infused into the udder at dry-off can help to kill any bacteria that can cause problems during the dry period, such as Staph aureus, Strep agalactia, and non-aureus staph species. Dry-off can also be uncomfortable for does due to pressure buildup for several days after we stop milking. The teat sphincter should prevent bacteria from entering the udder, but challenges like excess internal pressure, malformed teat ends, or trauma to the teat end can put does at increased risk for pathogen entry shortly after dry-off. Dry therapy can help to prevent bacteria from entering the udder during the dry period. Does that have had 2 or more incidents of mastitis during the current lactation, those with high somatic cell count, or who have had clinical mastitis within 14 days of dry-off are considered to be at high risk of developing clinical mastitis during their next lactation and should be targeted for dry-off antibiotic treatment. Mitigating these issues during the dry period helps to decrease the risk of clinical mastitis in the subsequent lactation and prevents associated production losses. This leads to improved overall animal health and longevity, as well as production of high-quality milk. When it comes to dry treatment strategies, you have options. Let's discuss each one so you can decide which is best for your farm. One strategy for managing animals at dry-off is not to use any kind of treatment. This may be appealing for herds that are organic compliant or who do not have adequate record systems to support prudent tracking of reproduction and treatment metrics. Benefits include no treatment-related costs and no antimicrobial residues to worry about after kidding. As we discussed earlier, animals, especially those considered high risk, have an increased chance of developing problems in the upcoming lactation without dry treatment. Those problems can range from decreased production to clinical mastitis. Producers must balance animal health with their ability to track reproduction and treatment data. Farms that do not have adequate record systems for managing this information may face challenges with antibiotic residues in milk and should work with their veterinarian and local extension agent to improve records before utilizing dry-off therapy. Blanket dry therapy means that all does receive antibiotic treatment, regardless of udder health history or current status. Remember, a prescription from your veterinarian is required to purchase these antibiotics. Your veterinarian should also provide you with meat and milk withdrawal times on this prescription. Blanket dry therapy can help to improve milk quality and animal health, but may also entail unnecessary antibiotic use, as not all does are considered high risk and in need of antibiotics. In cattle, blanket dry therapy has been shown to reduce Staph aureus and Strep agalactia and is also effective against some species of non-aureus staph, which can cause subclinical mastitis in dairy goats, leading to production losses without overt clinical disease. Use of blanket dry therapy is associated with a decreased risk of mastitis and high somatic cell count in early lactation. Record keeping is essential to effective dry therapy implementation. Producers need to know breeding dates or have accurate fetal ages from ultrasound pregnancy diagnosis by their veterinarian in order to plan an appropriate length dry period. Dry-off antibiotics all have a statement on their label to the effect of, "Do not use X number of days before calving." Despite these products being labeled for cattle, these recommendations should be followed by goat producers as well. There are costs associated with blanket dry therapy, including the drugs themselves and milk that cannot be sold due to antibiotic residues. Ideally, treated animals would go into a separate pen during the dry period or at freshening to ensure that they are not milked into the bulk tank until their residues are cleared. Leg bands or some other visual marker should also be used to identify treated animals in case does get into the wrong pen, but as we all know, these can't be relied upon as a sole indicator that an animal has been treated, since many goats do not tolerate leg bands or other identifiers. Records and permanent ID are the ultimate method of tracking animals on farm. After the recommended withdrawal period has passed, producers should test their milk for antibiotics before putting a doe back into the bulk tank. Targeted dry therapy uses animal health records and test data to target high-risk animals for antibiotic treatment, while low-risk animals are left untreated. This strategy allows for the most judicious use of antibiotics because low-risk animals do not receive treatment. This means that compared to blanket treatment, producers can save money by buying less antibiotics and having fewer animals with milk withholds in the post-fresh period, while enjoying the benefit of lower risks of clinical mastitis and decreased production during the upcoming lactation. The biggest challenge to this management strategy is that it requires excellent record keeping and animal management skills. Not only do producers need to be able to accurately predict dry period length, they must also be able to differentiate between treated and untreated animals. Using visual cues such as leg bands, as well as separate pens for treated and untreated animals, can be helpful, in addition to utilizing treatment records. As with blanket therapy, milk from treated animals should be tested for antibiotics before the doe is put back into the main milking string. There are on-farm tests that have been validated for use on goat milk to detect certain antibiotics. If you ship your milk to a commercial processor, they may be able to recommend a testing system based on what they utilize at the plant. Processors using milk for at-home consumption should consult with their veterinarian to determine which testing system is most appropriate for the type of antibiotics they use on farm. Test selection is based on which antibiotics are used as well as what type of animal the milk is coming from. Tests are not effective at detecting all antibiotics in all species. If your veterinarian has questions about testing milk, they can contact your local regulatory agency or milk handler. We can also be reached with extensions about dry therapy in dairy goats at dairygoatextension@iastate.edu. Dry treatment can help to improve milk quality, animal health, and longevity within your herd, but accurate records and attention to detail are necessary in order to produce the highest quality milk.